Good evening. This is the second video about abortion. I'm not a political ideologue. I do not care about labels. I'm a problem solver and I care about solutions. So what is the problem that animates this discussion about abortion? Very simply, it's that there are too many unwanted pregnancies. Now, there are two ways to solve this problem. Number one, prohibit abortions by making it very difficult for women to access these services and criminalize the behavior of anyone who attempts to help the woman. Or offer comprehensive sex education appropriate for the age of the student and make contraception easily available and affordable for both men and women. Let me start by discussing my concerns with the first approach. It's predicated on the assumption that by threatening men and women, you can dissuade them from having intercourse. Well, I hate to burst your bubble, but that's not going to happen. We tried this decades ago with drugs. Nancy Reagan had a don't for don't say had a program, Just Say No, and there followed a spate of draconian laws that were imposed on men and women who used drugs. Didn't work. Won't work with sex either. The average age at which an adolescent has their first episode of intercourse is about 17. Individuals between the ages of 18 and 29 have intercourse about 112 times a year. For those between 30 and 39, the number is 86 times a year. And for those between 40 and 49, 69 times a year. The Centers for Disease Control estimates that a woman under 30 who has regular, unprotected intercourse is more than 75% likely to become pregnant within a year. To put it bluntly, no contraception, lots of intercourse, lots of unwanted pregnancies. Denying women access to safe and early therapeutic abortions just pushes them to seek abortions later in their pregnancy and in circumstances that are unsafe and cause excessive injury and death. This is not the way to solve the problem. So let me turn to the second solution and talk money. In Tennessee, the average cost of prenatal care and normal spontaneous vaginal delivery is $6,800 with insurance and $13,000 without insurance. For a C-section, it's $10,000 with insurance and $17,000 without insurance. In Tennessee, the average annual cost of contraception with and without insurance is birth control pills, $250. IUDs, anywhere from $11 to $200. Birth control implants, anywhere from $30 to $430. The Depo-Provera shot can be free in some circumstances or cost up to $245 a year. But there are more costs to unwanted pregnancies. Many of these pregnant women are addicted to opioids, and their children are born addicted to opioids and therefore experience neonatal abstinence syndrome. In Tennessee, in 2018, we had nearly 1,200 such babies. Cost us $50 million to care for them during the first year, about $43,000 a year per per child. The cost of caring for a healthy child for the first year of life is only $5,000. So I have a friend, very socially conservative, who, when presented with this information, responded, providing comprehensive sex education and making contraception easily available and affordable is immoral because it communicates to these unmarried adolescents and adults that premarital sex is okay. Well, my response was this. We have many, many thousands of people in our state who are in dire need of basic primary health care. But due to fiscal concerns, our legislature refused to expand TennCare. What is immoral is wasting so much time on an unworkable solution, i.e. banning abortions, when there lies in front of us an irrefutable way of preventing unwanted pregnancies, reducing abortions, and saving millions of dollars that now could be directed towards those in need of health care. I'm not a political ideologue. I do not care for labels. I'm a problem solver, and I care about solutions. And I've just given you one. Thank you.